Good morning, everyone. Thank you for joining us again for another episode of our mental health podcast series. So again, I'm Jim Welch. I'm the clinical and operational lead nurse for mental health liaison services, and I'm joined today by my colleague,
Louise Page. I'm a mental health nurse and work for the mental health liaison team.
Thanks, Louise. So for the purposes of this morning, we're going to look at successful strategies in de-escalating someone who may be in a state of emotional distress.
Mm-hmm.
Yeah.
Yeah.
So I guess the first question for me, Louise, would be, what is a crisis?
I think a crisis is very individual for everyone, but it normally is where somebody maybe has just got to the stage that actually life becomes really difficult and normal coping strategies can't really be used. For them, for that kind of thing. So it's very subjective really from one person to another. So what I'm going to see as a crisis may be very different than you can see as a crisis, but it's the truth for us at that stage. So we really lose our inability to manage things in a way that we would normally manage everyday life. So it's just an overwhelming experience. I don't know if you've got any other thoughts about how you would think about it.
I think that the point of kind of losing your coping strategies, isn't it? It's a primal, it's almost a purely emotional response.
Absolutely,
So
yeah.
the person's ability to think through the situation presenting to them is really quite impaired.
Yeah, absolutely, yeah. So it's a really difficult situation for things, and different things can get us in those kind of ways. It could be, and lots of things have led up to that circumstances. It mightn't be just that particular thing. It might be just a series of things where we kind of get to the end of our tether with everything.
So perhaps quite minor events.
Absolutely.
We think about admission to hospital. You think about strange environments, strange people being cared for, being physically intervened with.
Absolutely, and it could be that you couldn't find any parking. You didn't know where you were going. You've been to 3 different apartments. You've asked 3 different people where to go, and you come to this person. You think, actually, they're going to solve my problems, and when they can't, that can just feel like the final straw sometimes. Yeah.
And I guess a crisis can be angry, it can be tearful. It really, again, the style in which someone experiences a crisis is very individualised.
Yes, yeah, absolutely. So yeah, and again, it can come out as in externally or externally, really, towards things. So it could be. We could harm ourselves when we're really distressed with somebody, or we could actually threaten to harm other people when we're feeling that distress as well. So it really is very individual. Or we might be able to get out and just have some air and be able to manage ourselves in a different way. So going out for a smoke and having that time to do things, but it is very, yes.
So that decompression,
absolutely, is
which
really
on
important.
a busy ward, if you're in a bed and you can't get out of that busy ward to have that decompression, I guess a pressure cooker effect might.
Just having that time, just be able to do things, and it's really sometimes we have to put ourselves in somebody's shoes and realise how difficult that situation is, where you're feeling disempowered. We've all had situations where we felt very disempowered at times, where we felt not listened to and things, and it really is very uncomfortable, a really uncomfortable feeling. So I think that's the most things, is actually helping people manage that uncomfort. And when responses that have helped us or not helped us are really important to think about. So where we've been told, oh, you look really stressed. Or you're not doing this well, are you? And things that doesn't help us sometimes. But sometimes the more kind of things, I can really notice that things seem to be really difficult for you now, and actually that can really help. Those kind of things.
That's something we'll come back to later. The form of the sentences, the language that we use, and the use particularly of I statements around, I can see or I hear, rather than the alternative, which is you need to or you must.
Yeah.
So the ownership inside of you as the clinician in saying, I can see that you are distressed, or I can hear that you're scared.
Really, really difficult. I wonder what happens to the brain then, Jim, and why people might respond to things in a different way when people get into crisis. I don't know if you've got any thoughts about that.
Yeah, definitely. Much has been made recently of ACEs, or adverse childhood experiences, and people think of those in terms of your increased vulnerability towards mental illness, your increased vulnerability to substance misuse, to self-harm. I think quite often people miss the degree to which adverse childhood experiences and stress hormones also affect the childhood brain as it develops. And what we know from the studies of Romanian orphanages, for instance, back in the 80s, is that children subjected to neglect actually develop smaller brains, physiologically smaller brains, and have many of the similarities of early onset Alzheimer's. So you actually have wastage in the frontal lobes, where a child, a young person, will actually have what you could consider as an acquired brain injury. And therefore they actually have less brain with which to think, more brain with which to feel, because the feeling element of the brain in the amygdala is far older, far more resilient than the frontal lobes are. So you can see that a person can develop an acquired brain injury, which later in life will make them more vulnerable to crisis, more vulnerable to stress and stress hormones.
So it's almost like the thinking part of our brain, when our amygdala, or reptilian brain really is kind of shut off, isn't it? So the thinking part of the brain isn't there really. So the normal responses we might use of I need to walk away maybe mightn't be there. So it's more we go into fight and flight. Is that what you're kind of saying?
Absolutely. So we're more prone to those extreme reactions to fight and flight, and we perhaps lack the ability to think our way through problems more clearly. So our emotional reaction takes over at an earlier stage. And one of the things we know with the emotional reaction is that once you are triggered, your thinking centres of the brain either have to be re-engaged or you have to disengage from the situation. And it's a difficult thing to suddenly think of ourselves as, I'm feeling, therefore I'm not thinking. But actually it's a very real and difficult situation for people to experience. So you mentioned fight or flight. And I'm sure many of our listeners will have heard the concept of fight or flight. Can you just describe that for me?
So fight and flight and freeze are the three responses that we do that actually are part of our reptilian brain, so where the amygdala takes control and things. So flight would be where we actually run away from a situation because it becomes just too overwhelming. And obviously freeze is where maybe we just stand there and just really don't know how to react. We're just absolutely stunned. So we look quite stunned. And obviously fight is where we don't know how else to deal with the situation other than to protect ourselves. And sometimes that might be through harming others or harming ourselves in certain ways. So that would normally be how that would present in ways, really, in terms of things. And really to come out of that situation, we need to actually reactivate our frontal lobe, where our thinking part of the brain kind of comes from, and really bring down our senses. And normally we can do that when we feel safe. So I always think about actually what makes us feel safe. So I guess it would be things like Maslow's hierarchy of needs. And I would always think, well, somebody, so what is making somebody kind of feel unsafe? So for example, or feeling in distress. So if they haven't eaten, if they haven't slept, if they haven't had anything to drink, all of those kind of primary things. I know, without any sleep, all of us, well, me particularly, I don't cope very well. So, if it has been really bad, and being in an environment, particularly, for example, an emergency department where you might have been in all night and the lights are bright and there are people coming in and you're actually asked to behave in a calm way, can be really hard for somebody. And it can also feel really unsafe as well. So if we look at Maslow's second step of actually safety as well, that can really make us feel really unsafe environment. It's not our place. I think as staff, when we work in places, it becomes it's where we are. We feel safe. We know the building. If I'm going in as a patient, I don't know the building. I don't know what you're going to do. I don't know what you're saying about me behind closed doors. If I'm paranoid, if I've got hearing problems, all of those things can add to me feeling really unsafe with things as well, like that. If I've got a delirium, those kind of things really affect us as well, really, in terms of things. If I really don't feel that I belong, if I'm feeling very suicidal as well, those kind of things can make me feel kind of things. And I'm almost looking for evidence that I don't belong when my mood might be quite low as well. I think so. I would kind of think about that. Is there anything else that you're thinking?
Yeah, I think Maslow was quite rightly saying in 1947, I think it was.
Yeah,
it's a very old piece of
very old
psychology now, but a 5-step process that kind of we work our way upwards in his pyramid to achieve what eventually is called self-actualization, which is the ability to grow, to learn, to develop new coping strategies. But what's key is that in order to reach the top of the pyramid, you actually have to climb it. So you have to go up the individual stages first. And for the benefits of people watching today, we'll actually put up a copy of Maslow's hierarchy so they can see what it means.
Absolutely.
But I think it's really important to think that in order for us to reach our potential, we actually have to have put the effort into climbing the pyramid and been supported to take those steps.
And it's been able to say to people, actually, now mightn't be a really good time to talk because you might need some sleep, or can I get you a glass of water? Can I get you something to eat before we deal with this situation? Sometimes that can actually in itself really help because, again, we're dealing with those those starting, those basic needs of meeting people. People feel understood, and sometimes that can prevent a crisis at the time. We need to think about, do we need to ask this question right now? Is there any other way that we can handle this that will actually be of more benefit to the person?
It's interesting we start to talk about communication and styles of communication with people. And I know much has been made of how much of what we say is actually contained in the words that we use.
It's quite interesting, isn't it? I think it's quite amazing that only 7% of what we say is part of our communication. The rest is really, how our voice is, how our tone is, and our body language. And a patient is presenting that way, but so are we. So we really need to become really aware of our own body language and our own tone and things. And although we might be saying things that actually might sound really helpful, sometimes in terms of if we think about our body language and our tone, sometimes they can come across in a different way. So it's kind of thinking and talking to everyone almost like we're talking to the Queen. So with total respect and just total dignity all the time and thinking in that way. And, that patient may have been in hospital 3 or 4 times. They might have presented like this before. We might have previous experiences. So it's really important that we're aware of that when we're thinking about how we're interacting with this patient at that time. Are those actually, judgments that we've made before about those patients still there? And are they coming across in our non-verbal language?
And I guess if we as communicators expect effective communication to take place, actually our language is a really inefficient way of conveying that message, isn't it? 93% of the communication is in your tone, it's in your voice, it's in your body language, the way you present and the way you style yourself in an interaction. And I know when I first came into psychiatric nursing, I found confrontation incredibly difficult because I'm a natural freezer and I'm literally just... So I had to kind of teach myself how to use my body and my tone, my voice to communicate even when I was scared.
Yeah, absolutely. I think it's so important, don't you, in terms of, and it can really de-escalate a situation when we think about how we are and we give ourselves time to just look at how our body's reacting. Sometimes that is just monitoring, do a body scan of ourselves, monitoring how we are before we go into a situation. And often we have to think about if somebody's becoming distressed, do we need to react straight away, or can we just take time to really ground ourselves and get ourselves in a better situation to deal with it and things. And I'm kind of leading on from that, it's really important that we really, when we are dealing with somebody who's distressed, it's just one person. So we're not dealing 3 or 4 people at the same time saying the same things. If you could imagine you're already feeling distressed and 3 or 4 people come in and say, you have to calm down, you have to calm down. That actually can lead itself to actually a person feeling very distressed and even more distressed than they were. I certainly would. I don't know how you would feel if that happened to you, Jim.
I mean, I struggle in rooms with more than 2 most of the time. I think, really if a V&A call, violence and aggression call, for instance, goes out and everybody responds, I think you have to accept that everyone running to that call is already in a state of heightened adrenaline. They're expecting or anticipating what might happen. You then have 6, 8, 10 people in a room. I think it can be very difficult to get a confused message to the individual. And I know one of the things that we very often do when we arrive at those situations is send everyone away and just take control and calm the environment itself first.
And I think it's also important to be aware of the times where maybe if we're the person dealing with it and we can't cope, that's okay, that we have to really step back and we can say, this isn't a good time for me to deal with that. Or somebody brings up something that really triggers us because of what we've had in our experience. It's okay for us not to get involved. It's all right for us to say, I'm handing over to my colleague because at the moment, I don't think I'm the best person to help you. And that's really honest and truthful, and it goes through that circle of actually really good communication, truthful communication, and not to promise things that we can't provide, saying, oh, you're not going to be admitted to hospital, don't you worry, or the police won't be called, don't you worry, that won't happen. If we say those sort of things and they do, then actually that person was never going to trust us again when we come into hospital. So as far as I'm aware, this isn't going to happen, but I don't know. That's a really honest kind of response. I don't know if you've got any other kind of things that you use, Jim.
Yeah, I mean, I'd like to think of it as almost having a hot button. We all have a button, and people close to us know exactly what pushes those buttons. Strangers don't. But it applies just for us as much as staff as it does for patients. We all have our trauma. We have vicarious trauma that we absorb through our working lives of some of the things we see and deal with. And that can predict how we're going to react in certain situations. So I think situations with patients can sometimes push our buttons. And it's important, I think, to remember in conflict that a conflict is not time to demand respect. It's not time to ask someone to show you respect for your role or your seniority. The person isn't targeting you as the individual. They're targeting you as the face of the organisation or the face of the challenge that they're encountering. So it's important never to take things personally.
That can be really hard, can't it?
Yeah, I mean, somebody stood in front of you screaming or calling you all kinds of unpleasant names. It's natural, but actually, swear words are simply an expression of distress. Names are just a noun designed to get you to respond in a certain way. And if I use particularly offensive ones, I can predict you're going to respond offended. So it's being conscious of that.
And conscious, I guess, of boundaries as well. So when people are doing that, we can say, this language isn't getting in the way of me helping you.
Exactly.
And
I know there's an author, Noel, who I think it was 2022, talked about, did a lot of work in American penitentiaries and developed a de-escalation model. And Noel was quite clear that the best model is, firstly, I statements, but to ignore the content of conversation, but focus on the emotion underlying it. So I can see you're scared. I can see you're angry. I can see you're in pain. Not, you need to be quiet, you need to sit down, you need to respect me.
And you're angry. And those sort of things. So so actually using that I thing is a really good tip. So I guess thinking about kind of the model of kind of, of distress and when people get into things, I guess if we've talked about kind of things that we can do. What about when somebody's in that red mist? What's the most important thing that we can do? What I mean is where maybe they're just absolutely so distraught that they're not listening or able to be. Is there anything that you think we can do when people are in that state?
I think so. Kaplan and Wheeler, 1983. We'll put up a picture of the model so that everyone can see it. It might help if we just talk that through.
That'd be really good, yeah.
So Kaplan and Wheeler did a lot of work into violence and aggression and into human conflict. And what they discovered was that when we move away from our baseline, from our kind of stable emotional state towards a crisis, well, firstly, we identify a trigger. And that trigger for us is a significant threat. And the identification of that threat will be based on our experiences, our trauma, our vicarious trauma, our own ACEs, for instance. And a threat will be perceived differently by everybody. What is, I think, important to realise is that the response that someone is showing to a situation is individualised. And it will be disproportionate based upon their experience. So we then go into what they call the de-escalation phase, and this is where the person is beginning to heighten.
Right.
The amygdala is beginning to respond, the stress hormones are starting to flow. The body and mind are preparing for a conflict. You know, we talked about the fight and flight response, and this is where that is really firing. You see someone move from there into a crisis phase, and this is where, you know, you might see the more extreme behaviours. Actually, when someone is in a crisis, it's not the time to talk about the future or talk about what to do differently or how to behave differently. So it becomes environmental control.
Right, okay.
The logical brain is disconnected, so actually you need to control the environment, you need to control your own emotion and consider how much fuel you're giving to an interaction.
Okay, so are you saying kind of the less language the better?
Small
Very
words.
Short words,
Yeah.
said slowly, maybe repeated,
Yeah.
and things can be really helpful. Making sure there's nothing in that environment that actually the person can harm themselves or anybody else with at that stage.
Exactly.
So if there's anything there that maybe that can be just removed quickly, and we can just talk about. What about kind of space and things then, Jim, when somebody
Yeah,
is in
so
things?
there's actually a science of human spacing.
Okay.
It's called proxemics.
Okay.
I don't know how I know that, but I do. And it's really interesting that it is culturally defined.
Right.
So for instance, I have quite a large Italian family.
Okay.
And in that family, they use Italian proxemics. So the hands move rapidly and wildly. They are far closer to you, so they don't have the same kind of social distancing. So they're right closer to you,
Yeah.
which when you first walk into that can feel really alien. It's important, I think, from a cultural perspective, to be sensitive to the cultures of our patients. For instance, in British society, intimate space is often seen as being about 2 feet.
Okay.
And intimate we define as being the people with whom we have intimate relationships. Yeah.
So
Pretty
our
obvious,
partners,
but
our families, our best friends,
yeah,
those kind of people.
exactly.
So
The people that
can
we trust.
So sitting beside a sofa with somebody that close.
Yeah. Now that's you do it on a bus, but you don't do it on a bus in the same way.
Yeah, you're
with a
normally
stranger.
not given any eye contact, are you? Yeah.
Yeah, exactly. And we then go from there to personal space, which in the UK, say the UK, it's a blended culture now, but in standard UK, if you will, it's about 2 to 4 feet.
Okay.
So within 2 to 4 feet is where we feel comfortable with people that we have a personal relationship. You then go to social space, which is 4 to 8 feet.
Right.
And that's kind of people you might know in the pub or in the gym or just in your social or colleagues at work. Public space is quite interesting in that it's 8 plus.
Right.
So you're
So
talking
quite a way. Yeah.
bit of distance between individuals. What we know from proxemics is that in order to de-escalate a situation of conflict, you actually need to consider that in factors of 3. So you need to be thinking about being somewhere between, 24 feet, for instance, away from somebody to give them the sense of not being crowded.
Okay.
And at the same time, we need to be thinking about our hand gestures and the amount of eye contact that we're giving.
Okay. So keeping your hand gestures quite kind of there, making sure your hands are visible to the patient is really important. Yeah. So if they're paranoid or suspicious in any way, they don't think you've got anything to harm them with. They don't think you're coming with them with a needle. I guess in a general hospital, that might be that fear. Yeah. So really keeping those sort of things and keeping your body language and yourself as calm as you possibly can.
Exactly.
So slow is better.
Slow, measured, calm. So you're right, you want your hands visible. Eye contact in British culture is roughly 4 seconds, then you look away for a second, then you look back for a second, roughly.
Okay.
So incessant eye contact, so constant eye contact, is actually a sign of a threat in nature. But what can happen in conflict situations is people make eye contact thinking, I'll reassure you. But actually, you do need to be taking breaks in eye contact. Yeah. Otherwise, you can appear as a threat. Okay,
so really making sure that maybe you look down at the ground at times when you're in that situation.
Yeah.
So you're not constantly really in there. What about kind of being face-to-face, or is it better to be slightly kind of side by side? What's the best way to be when somebody is aggressive? Where is the best place to stand?
Well, I think, again, psychology comes to our rescue there with the work done by Jared Egan, who looked at the model solar. It was sit squarely,
Okay.
Which is to say, if you're close to someone side by side, they can't read your body language as effectively as they can if you're directly opposite them. But again, you don't want to block someone from being able to pass you.
Okay.
So I wouldn't stand squarely in a doorway because then I'm preventing someone from being able to get out.
Good.
I would have an open body posture, which is to say my arms aren't crossed.
Right.
What you see in some positive behaviour management is that the people adopt what's called the inquisitor stance, which is a hand on the chin. Many reasons for that. One is to be able to blat away or to block any assault that's coming, but also it shows an interest.
Okay.
You lean slightly forward. So you demonstrate to the person that you're engaged and you're listening and paying attention. You make that 4 seconds of eye contact and break it. And above all, and this is probably the most important part, you relax. Because most conflict lasts for no more than 40 minutes.
Okay.
And what we were talking about a little earlier in terms of that cycle of assault, the Kaplan and Wheeler model, after the crisis phase, we move into recovery.
Right.
But during the recovery phase, we're actually more prone to re-escalation because our body chemistry is still coming back down. So a rule of thumb is that after someone has had an emotional crisis, engaging them in problem solving, in planning, in future thinking, you need to leave about 40 minutes.
Right, okay. Is that because the hormones are still kind of going around our body at that stage? So we're still so although we might be calm, it's the spark is still there really to set it off, isn't it, really?
Yeah, completely.
In terms of how we are. So it's just about really, again, keeping ourselves calm and keeping that situation as calm as we can.
Yeah, and any fuel applied to that fire is more likely to reignite it.
Okay.
So it's after the event, it's about maintaining that calm position, maintaining control of the environment, but in a supportive way. And then later, 40 minutes later, looking at what can we do differently next time.
Okay. Okay. And can that be done really, afterwards, somebody being invited in afterwards to think about it with them and think about what's happening? What about for us then, when we've dealt with the situation and I guess when we've had to get maybe VNR involved or whatever else like that, when that's been really difficult? What about our own self-care? I mean, I don't know how important you think it is. I think it's really important that we look after ourselves after that situation, that we don't just rush into the next patient and try to save everyone, because we're still going to have hormones going around our body. Yeah. We're still not going to be in a place.
I know you can see, or we have seen historically in psychiatric units where restraint has been cultural, that actually people went from one event to the next event still in a state of emotional arousal, made the outcomes for the patient significantly worse.
Absolutely.
So it's about finding that opportunity to de-escalate ourselves, but also accepting that perhaps what we're doing feels morally, ethically uncomfortable.
Yeah.
And being able to talk to our colleagues about how that feels and how we carry that burden into the rest of our day or going home and our families that evening.
And reflection can be really good, isn't it? So sometimes just reflecting on that incident with ourselves sometimes, or really in another safe space, but it might be using the resources we have available at the hospital for people to talk to, but really reflect on that. What did we do? What could we have done differently? What might have helped us deal with things? For me, that's really important, I think, as well. And I think it could be a really useful tool for people to use when they think about when people are kind of things. What resources are out there in the general hospital for people to use if they've had a really difficult experience and things are really hard then, Jim?
So I know Working Well is always available if people are having a health consequence of that. There's the Employee Assistance Programme, which offer employees the opportunity to explore their experiences in a supportive way. And you also have staff psychology through the 2020 Hub. And I know Amy Lawson, who's a psychologist with that service, does a lot of work around the hospital, helping people to explore adverse incidents, to debrief them, but also to explore the cultures where they happen and how individuals can cope. So really important to access those services because, as I said, vicarious trauma or trauma one step removed builds up over the course of a career. And we as professionals can carry those scars unaware for a very long time.
Okay. I guess it just needs somebody to trigger those scars sometimes and trigger our responses sometimes that can actually make us maybe not deal with a situation the way we would like to, really.
Yeah, there goes your hot button, and you're back into a predictable pattern of behaviour.
And thinking about our language, so language that heals and language that harms, sometimes I think that's really important to think about as well, just as a recap. Is there any kind of top tips that you'd say?
I'm going to ask you.
I guess for me, it's kind of really just thinking about how we present and how we think about somebody. So if we use very fleeting terms, or they're attention seeking or they're drug seeking, what we know from research is actually the treatment that people receive in hospital won't be so often to the degree or nature that they need to have. So for example, if we say that somebody's drug seeking, then maybe they might be limited in what painkillers they might need, when actually they were reasonably kind of needed that, and it was actually indicated clinically and things. I just think really just being aware of our language, being aware that we're using language which is trauma-informed, I think is really important. So again, the I things, the compassion, all those sort of things really comes into place. Not overly compassion and things. So really thinking about, how we do things in a way that's truthful and helpful and actually really is going to move that person on.
And I think there's something about the attribution theory.
Yeah.
So the principle being that if we perceive the behaviour of another person as being in their control, but that behaviour is negative or confrontational, then we can blame, we can judge, and we perhaps apply a more critical eye. But if we view it as being external to the control of the individual, perhaps as a result of all of their experiences, we're more likely to respond in a supportive, compassionate and empathic way.
Absolutely, yeah.
So I think there's something about being aware, if not changing, but being aware of how we interpret the actions of others.
Absolutely, yeah.
I guess to summarise how we can respond to someone in a crisis, I think it's important to be aware that people aren't thinking, they're feeling. And you're dealing with an emotional state, you're not dealing with a logical one.
Okay.
Again, important to accept that very few people are personally difficult. There are some. The majority of people are situationally difficult. So it's the situation which someone finds himself in, not them as a person, that is changing their behaviour.
Okay.
It's also far easier to control your behaviour, or my behaviour, using you statements. It's far easier to control my behaviour to influence yours or the person's than it is to try to influence the person's behaviour to change towards me. Does that make sense?
I think that's really good. So I wonder if we could look at kind of the do's and don'ts of what might be helpful in a situation
absolutely.
and things like that, really. So I guess, shall we start with the do's? Should we start with the don'ts?
Yeah, go with the do's.
Go with the do's. So really be aware of our own situation, isn't it? And our personal safety, I think, is really important, and things. Introducing ourselves in a clear voice and speak calmly. Checking what the person wants to be called as well. I think that can be really important. There's nothing worse than having a birth name and not using that birth name, and everyone knowing you as something else, and somebody constantly using it, and it might bring up past trauma for somebody. So how do you want to be called? What pronoun would you like me to use for you? Those sort of things can be really helpful, can start really. I think that can be really important. And also maybe repeating information, particularly if somebody is distracted, that somebody might actually be having a psychotic episode, so they mightn't be able to hear you. So repeating things again in a very calm way and being aware of things, I think is really important. And being patient, give time really for the situation, give people a break. So sometimes it's really important to say, is this a bit overwhelming for you? Do you need to actually have a bit of time out before we continue this?
Can I come back to that later?
Absolutely. So if you know that something is triggering somebody, then put that on ice. And you can always ask it at a later time in the interview. So just being aware of that. You can see that from people's body language. They might start tapping, or they might actually just their whole physical kind of situation can go quite stiff and things. So sometimes it's good to know less is more. Let's just hold this. and let's come back to this at a different time as well. So reduce kind of the background noise as possible. So going into an environment where it's not maybe noisy or it's not that kind of difficult can be really helpful. Please and thank yous go a long way for somebody. Thank you very much for actually speaking to me. Thank you very much for allowing me to talk there. Those kind of things. Please, can we do this? All of those kind of things. Again, it's treating someone as an equal to you, and I think that can really help.
And I think if you're going into somebody's personal space, permission is really important. And I'm sure everyone listening to this already gets that, but actually getting permission for the process or the procedure that you're about to do before starting the procedure.
Absolutely.
And giving the person a clear expectation of what's going to happen and how that's going to feel, I think is really important. And I'm sure people already would.
Absolutely. Being assertive but friendly at the same time. So this is what the rules are, this is what we're going to do, but it doesn't have to be done as a school momish way. It can be done in a way that's actually saying, these are the rules we both have to follow, we both have to be respectful, we both have to listen to each other. It can be done in that kind of way, I think, really. Is there anything else you think in terms of the do's?
Well, I think conflict is... It's perhaps easy to walk away from a conflict with one person losing. And in an ideal situation, what we would want to do is to achieve a situation where both parties walk away with something that they need. Now, that may be someone who is no longer shouting or screaming. That person may need to go for a cigarette, for instance. It can be a simple process to work out how to achieve a mutual win with somebody. So they feel that they've come away from that conflict with their needs met, but equally, from a staff perspective, we've come away with what we needed to happen as well. So I think important to consider. It's really important to announce what you're going to do.
Right.
I said a little while
really
ago.
important.
Coming into my space, I need to know why, what. Don't just stick a blood pressure cuff around my arm and expect me to be fine with it.
Okay. So really just telling people in advance, I'm going to go and get the blood pressure machine, and then explain the whole process. Because people mightn't understand. If you say I'm going to get the blood pressure machine, they mightn't realise it'll go around the cuff. The cuff will go around their arm, and they mightn't realise what's going to happen. And actually, it's going to become quite uncomfortable. So all of these kind of things, it absolutely really important, isn't it? Really, that we explain to people.
Really simple things.
Yeah.
So I think, where possible, giving people options. Giving them the power to make a choice.
Right.
And I appreciate that's not always easy, but I think if you think about the majority of conflicts, it's a person is saying to you, I need something to be different. And it's on the communicator's it is the communicator's responsibility to work out what that difference needs to be and to offer it to the person where possible.
So, and also, I guess, leading on from that, it's about just being honest. So if I can't do something to help you, I'm going to let you know and say, at this stage, I really don't know the answer to that question, but I am going to find out. I'm going to do my best to find out. And if I can, I will get back to you. It might be in a letter, or it might be in a different way, but I think that's a really good question to ask. So somebody is asking for something, acknowledge that actually that's really important to them. It's something that they want to know, and actually saying, I mightn't be able to solve this, but I'm hoping that I can find somebody who can, or maybe we can research that together at some stage.
And I will come back and I will share what I've said, and you can have faith and trust in me.
Yeah.
It's important to remember that trust is broken once. It's never the same again.
Yeah.
So if someone has faith in what you say you are going to do and you fail to do it, that relationship will be less than it was. So really important to own and to return to somebody when making a promise, to give them the further information.
What would be the don'ts then, Jim?
I think we've talked about proxemics. We've talked about the science of space. So don't crowd somebody.
Okay.
So you need to allow that natural space to exist. Control the environment around the person, so that you don't have a dozen voices. You don't have the noise from outside the door. The person can hear you clearly. So you control the volume. You control the environment. I wouldn't, for instance, engage someone with touch
Yeah, touch is a really sensitive thing, isn't it, really? So when somebody is very distressed, and we know about the actual not being too near somebody, but if I go and try and put a resting hand on your shoulder, you might interpret that as me trying to attack you when I'm in a state of real distress. So,
and if I have a history of being assaulted, or a history of from childhood of being abused, that touch from a power figure can actually be really powerful.
Okay, so if I'm going to touch you, I guess I need to say, I'm just going to put this round your shoulder, or I'm going to just move this from the room, all of those sort of things, or I might need to brush past you at this stage. So they're really important things and things. And I guess, what about, I'm thinking about kind of PRM medication that can be really useful sometimes if somebody is in a state of distress. You know, bringing that up, would that help you? I'm thinking that might be something that might be helpful to you. We could do that kind of thing, rather than just presenting somebody with a tablet and say, here, you have to have it.
Have to take this.
So really kind of thinking about the reasons why, so it's given very clear in short sentences why we're going to do things, rather than just presenting things in or coming in. Sometimes there are situations where a situation can escalate and we have to act really quickly, and that's okay. But mostly, probably 96% of situations, it can be resolved by the techniques that we're talking about today.
Absolutely. And I guess I'd encourage the listeners to, another part of this series actually looks at the emergency sedation protocol and the use of emergency sedation in urgent situations. So I'd encourage the people listening to us today to review that tape.
Really good.
God, that's probably 1990s. To take advantage of that masterclass as well.
Lovely. Okay.
Listening. We all listen. We don't all listen well.
Absolutely.
And I know when we did our training, psychiatric nurses, we were taught how to listen. And a lot of our education went into learning listening skills. Could you describe some of those?
I guess it's just really actively listening. So showing that we're actively listening and things. Really just kind of by nodding and hearing things and rephrasing what somebody has said. So maybe, for example, if you tell me, I'm feeling really upset about this situation, nobody listened to me, it's okay for me to say back to you, so you're feeling really upset about that situation and nobody's listening to you. Tell me more about that. That's okay. But it might sound like a really silly thing to do, repeating what somebody said, but it can actually really validate the person and can calm a situation down really, in terms of how we are communicating and things with those sort of things. So paraphrasing, kind of feeding back, thinking about, again, how our voice is and how we're communicating that really. We don't have to, there are little tricks that we all use in terms of communicating and things.
So I guess we're listening for the feelings of the person.
Absolutely, yes.
And seeing through the behaviour.
Yeah. As I said, clarifying is really important. Reflection about what a person said, summarising what they said, so what you want me to do, and checking we've got that information right, because often what we hear can be really different than what the person meant. So actually it allows the person to say, that's not exactly what I said, and we can change that, and then actually feeding back the revised version is really important as well with somebody, so they can hear that really back to in terms of kind of, that we know that somebody feels they're being heard as well, that they're being listened to and things. Observing for how our body language is, so what we're saying, how that's maybe affecting somebody. So we might say a certain word and that might trigger somebody in a certain way, or it might actually bring somebody slightly forward for us. So when I'm sitting and talking to somebody, I will kind of lean slightly forward, and it shows I'm interested with them. Again, my hands will be very kind of clear for somebody so they can see what I'm saying, and I will listen to the feelings and observe all the body language, really. The paraphrasing is really important as well. So hearing back, clarifying is really questioning and open questions.
Yeah. So you're not using closed, you're not using you're inviting the person to explore more about what they're saying.
Absolutely. So if I kind of say, you know, you're angry, and so you're very angry, I just say that, and it can be, you're angry. So I can kind of say it again, but I can say it in an inquisitive way. Sometimes that will open up a question rather than me just saying it in a different way. So, and I guess there's loads of times where we can use more open questions really in the things. And tell me more is a really good kind of trick for when somebody is trying to say something. So tell me more about that. Are you able to expand on what you mean by that? Let me know a little bit more. I'm really interested in that. I mean, really interested in how I can help with that. What can I do differently? All of those kind of things when we're communicating as well, I think is really important. What can I do to help? What have you come here for? So getting people to think about what their needs are and what solution they think that can be given towards the problem, because it may be that their solution is, I just want an appointment in 2 weeks' time. That's all I want to know, rather than, and our expectation may be that they want a problem solved straight away. So actually really there can be a mismatch sometimes, and making sure we're both on the same page in terms of communication can be really good.
I think I would apply a caution to a technique that is often used, which is called mood matching. Which is meeting the patient's language, meeting their energy at the same level that the person is. Well used by expert communicators, it can be very effective.
Absolutely.
But by joining someone in the use of kind of profanities, by speaking more loudly, by moving more quickly, you're actually far more likely to escalate the situation. It's about maintaining that self-control, that professional conduct. I can see that you're incredibly upset. I want to help. How can I help you? Not, you need to stop doing that right now.
They say we should talk to everyone like we're talking to the Queen, in that very slow, calm way that she would do to us. So that's how we should speak to somebody. So when somebody's in distress, think about you're talking to the Queen. So you wouldn't necessarily get distressed or upset with them. You'd actually be very gracious and calm, and you'd really be thinking about what you'd be saying. So that's always I think a really good top tip to think about when we're talking about things.
Fantastic. Thank you very much for your time.
Thank you, Jim. That was really
interesting conversation. And I hope everyone listening to it today has equally got something from it, and maybe a couple of little pointers just to take away.
I hope so. Thank you very much, Jim.